Welcome to SurroTalks, a weekly podcast where Kevin, a father of two through surrogacy, and Petra, a former IVF nurse and fertility consultant, unwrap all the aspects of your egg donation and surrogacy journey. Join us every week to discuss various topics around surrogacy and egg donation. Join us for episode 3, where we're going to talk about the surrogacy process from screening, embryo transfer, as well as a little bit about your legal agreements.
All right. So welcome everyone to episode 3 of SurroTalks. We're really excited to get together this week and talk a little bit more in depth about surrogacy, specifically the matching, the whole cycle between matching to delivery and what that looks like. We got quite a few questions about whether people should consider independent journeys or the values of agency. So we'll touch on those today. And as an overview for anybody joining us that's new, I am Kevin Heaney. I'm a father of 2. I had both my kids through surrogacy, one through an agency and one through an independent journey. I'm also a board member for Fertility Friends Foundation. We're a Canadian charity that provides grants to couples going through fertility treatment and needing a little extra help. I'm joined today with Petra, who was our IVF nurse when we went through our journey almost 10 years ago. And we've kept in touch. And since then, she's also moved on from the clinical side to agency side. So she brings great perspective. She herself was also an egg donor, which we discussed a bit more in detail last week.
Hi, everybody. So you're a bit crackly, Kevin, but I think we can hear you okay.
Okay.
So again, I'm Petra. I was an IVF nurse a long time ago, and for the last 4 years or so, I've been working with an agency called Extraordinary Conceptions, where we help egg donors and surrogates and parents. So we're really excited to really unpack surrogacy today and tell you a little bit about the process and where to get started. We'll see how much we can get through today. It looks like we might have to do a part 2 in some of these episodes, but we'll get through as much as we can.
Great. So I guess we want to start off around choosing a surrogate, right? There are 2 aspects or ways of going about it, as we've discussed. The first one is going through an agency, and the other one is going through an independent journey. Petra, do you think you can touch on some of the main points of the values of going through an agency and what services they would provide?
Yes, absolutely. So when you sign up with an agency, usually it'll start off with some sort of consultation so you can learn about the agency and how the process works with that specific agency in terms of matching and finding your surrogate. Every agency is going to be a little bit different in how they do this. Especially within Canada, there's going to be variables in how you find or are matched with your surrogate. So it's important to understand what that process looks like with your agency. At the end of the day, you should be receiving some sort of profile of a surrogate when you're ready to be matched. Now, this might not be immediate, as we may or may not know. Unfortunately, there's a lot of wait time in terms of finding a surrogate in Canada with many agencies. So when you're talking to them for the first time, it's important to know what to expect in terms of how long you might be waiting for a surrogate, as well as what their matching process actually entails. So some agencies will be very surrogate driven in their matching, where, a surrogate will receive lots of different profiles to choose from, and then you'll find out if you have a match request from her. Whereas other agencies might be more parent driven, in where they will present intended parents with the surrogate profile first, and if they're ready to match, then the surrogate will have the opportunity as well to see if it's a good fit for her. In terms of the profile, what you should be seeing is some history on your surrogate, where she's located, her height and weight, her pregnancy history, any relevant medical history, perhaps her family dynamics and living situations. So for example, is she employed? Is she a stay-at-home mom? What type of education has she received? And also, of course, very important is her traits and characteristics or personality. So you can take a look and see if you think it might be a good fit for you in your pregnancy journey.
I remember in ours, our surrogate had actually written kind of a letter to the parents to give an overview of who she was. And that was a great starting point for us to use in our conversations going forward.
For sure. For sure. Now, how is it different with the independent journey, Kevin?
So I guess there's 2 points. One, when we went through the agency process, it was about 10 years ago. Surrogacy was not as common, I don't think, or talked about as it is today. So we really got a lot of value from our agency at the time, just getting an understanding of the lay of the land and kind of going through all the information that we're going through in the series. Oops, make sure that there's no back.
Sorry about that.
And so, understanding how the clinics work, getting some information about who to reach out to in terms of our legals that would have to be done. So they really did walk us through the process from A to Z. It happened very, very quickly for our first round. Again, I think from the time we started discussions until we were completing our legals was 6 weeks. That is almost unheard of, I think, today, because the demand for surrogates has really increased. So I feel very fortunate to have done it when we did. I remember the conversation with the agency. So for the first round, the consultant really helped manage that initial chat, which was helpful because we didn't know what to expect. You're starting to ask somebody, a complete stranger, some pretty personal questions about who they are, their lifestyle, and it's a fine balance between, understanding what. Sorry, Petra,
Sorry, Kevin, I didn't mean to.
Yeah, no, that's okay. I can hear you.
Train of thought. I just wanted to make sure if everybody could hear Kevin okay. I'm having some trouble hearing him.
Okay.
If anybody looking can just comment. I think you might be okay now, Kev, but.
Okay. All right, sorry about that. I don't know what's going on. So the advantage of the having the consultant there that first time was she really helped us manage that conversation. If you have two people that are maybe more introvert, it can be a very awkward conversation. In our case, both the surrogate and myself are pretty outgoing people, easy to talk to. So there was an instant connection. And I think that's what we were looking for. Feeling that, you could go through this rather intimate process at the end of the day and not have it feel awkward or uncomfortable. And I think that's something you'll get a quick sense with. It was a little bit like speed dating. We had probably an hour talk by the time we were done. And in this case, because the surrogates are already vetted through the agency, it moves pretty quickly. And I remember the consultant at the end of the call saying like, okay, are we good to go? And Aleem and I being like, like we're going to be doing it now. And so that moved very quickly. On the independent side, it was a bit different because I took it upon myself to go out, look for surrogates on different websites, Facebook groups. And so you're dealing with people that may also just be at the beginning of their journey and considering this process. So they have a lot of questions and trying to understand what is going on. So I would say for that part, there were a lot more conversations involved. some that didn't lead anywhere, some that, either one party or the other decided not to move forward. And that took us probably a good, I'd say, 6 to 7 months before we met our second surrogate, who was based out of Sarnia. And again, as soon as we started chatting, there was an instant connection. And I think that's what you're looking for. It really is like dating. You want to make sure that you're comfortable with somebody, and that there's a natural flow to the conversation and lack of awkwardness when you're talking about pretty intimate, conversations.
Yeah. I
My
do
sound
want to
better now?
say too, though, it sounds like you were very lucky in that you had so many surrogates to talk to and go through that dating process with. I'm not sure that nowadays intended parents will have such an opportunity to interview so many surrogates or speak to so many surrogates. And so it is good to keep in mind, especially if you are going through a Canadian journey, that you might not find that perfect fit right away. And so it's important to perhaps weigh what is really important to you in terms of, finding the perfect relationship or being matched in a specific timeline.
I think what's important to remember is that you're being interviewed by them as much as you're interviewing them. And the reality is there's, one surrogate to many more IPs today than there was at the time.
Yeah. Yeah. Canada has become a very, very popular destination for surrogacy. Not only has surrogacy become more available and an option to more Canadians, but we have a lot of international families coming to Canada as a safe space for surrogacy. A lot of people don't realize that many countries in Europe have banned surrogacy, or will only work with heterosexual married couples. And of course, elsewhere, even outside of Europe, many countries have banned surrogacy. So Canada has become very popular, especially with our altruistic model. And this has really affected the demand for surrogacy and the availability of surrogates who are ready to be matched.
Yeah, absolutely. One of the nice things about the independent journey for us is that there was kind of a direct contact with the surrogate from the beginning. But at the same time, when you're working through an agency, it's also nice having that support system to go to and ask questions that you may not feel comfortable asking directly to a potential surrogate.
For sure.
So there really are pros and cons to both. I think one thing to keep in mind is that going through an agency doesn't necessarily mean that you are going to find a surrogate faster. Again, because there are so many IPs out there, there's usually a long list of people waiting to be matched.
So where can you look for a surrogate outside of an agency?
So there's a lot of groups on Facebook or different social media sites. I remember different websites. There was, I think, findsurrogatemother.com. Just go to Google, type in surrogacy, independent surrogacy, see what kind of websites pop up. I think there's much more technology out there today than there was even 5 or 10 years ago. Facebook is definitely a very common place where people go. Last night I saw one of a lady post that she was looking at doing an independent journey, and she had posted it around 11 o'clock last night. Nobody had commented on it, and this morning I went back to look and there were already 40 messages public. So God only knows how many messages she got privately as well. And that's the reality, is you have to move very, very quickly if you're looking at doing an independent journey, because you want to be at the head of the line when somebody does come up. And so in our case, I remember logging in every morning at 7 a.m. onto these different websites and seeing if anybody new had logged on and sending them our profile right away, having something ready to go, and doing that several times throughout the day to make sure that anybody new that was just joining the sites, we would get to them first.
For sure. Sorry, I'm just trying to hear you better, Kevin.
Can you hear me?
Yeah, I see these Facebook posts with, both parents who are sharing their journey or sharing a little bit about themselves, looking for a surrogate, and they might receive messages from independent surrogates who are looking for a match. Or like you said, if the surrogate posts on Facebook that she would like to be matched, she will definitely get a lot of communication from parents who are looking for somebody. So it's I can imagine that can be very stressful to try and get on quickly and share your personal story and put yourself out there to strangers.
Yes,
really
sure. It can be very overwhelming.
Try and match for your journey. Also wanted to mention there are kind of these there is a middle ground of working with an agency and working independently. Some agencies do offer services that they might not be coordinating your entire journey, but they might help you with one aspect of it, such as the reimbursement of your surrogate. So if there are certain parts of your journey that you're not sure of, an agency might still be able to help you through your independent journey in, certain aspects of it that you might not be able to take care of yourself.
Yeah, and that's something we definitely did. So when it came to the reimbursements, we wanted to have a third party that was a bit of arm's length so that, everything was being done by the book. Because it's important to know that in Canada, it is illegal to pay somebody to carry a child. So we wanted to make sure that we were abiding to any laws, and that if for whatever somebody got audited, all the proper processes had been followed. So
Right.
It's a very good point.
Another thing I wanted to point out is when you're working independently, it is still very important that you have all the right providers in place. Of course, you may or may not have a fertility doctor involved. We probably would recommend that there is a fertility physician. But it is really, really, really important that you still have a legal agreement. So, we have heard of traditional journeys where the surrogate's eggs are used as part of the process, and it could be just a at-home insemination that is done, and that's still allowed and it's still legal in Canada, but you definitely want to have a legal contract in place before the surrogate gets pregnant, so that there's no question of who the intended parents are of the baby, and just everything is very clear on the contract of what is expected from both parties.
Yeah, that's a very good point. So go through the process a little bit in terms of matching. I guess we've kind of talked a little bit about some of these topics.
Yeah, I think there's a couple of things I wanted to mention too about matching, in terms of, and you've mentioned a bit about this already, Kevin, in terms of what to kind of ask when you're speaking to each other for the first time. One of those things is timeline and availability, and surrogates will have their own life, of course, and so they might have certain conflicts in timing, or they might want to plan for the pregnancy at a certain time of year. And so that should be known to each other when you enter a match. You might also want to ask about her lifestyle. Does she have any special diets or exercise that you feel will be compatible with your journey? Do you have any special requests for her during the pregnancy, like a special diet or eating vegan or something like that? This isn't always common or expected, but it is important to some people. Another factor is religion. Does this play into your needs at all for your surrogacy journey, or does it play into hers? She might have religious beliefs that might affect her position on terminating a pregnancy, or you may. And so these are very, perhaps difficult conversations to have, but very important to discuss at the very beginning of your journey so that you can ensure you're on the same page, so that if anything comes up in the future, especially during a pregnancy, there's no disagreements at that point in time where, it would be too late to disagree on something so important.
And those are difficult conversations to have at any point, but especially when you have multiple people involved in this kind of
stuff. Absolutely. And it's important for both parties because, of course, the parents are going to, when we're talking about termination, the parents are going to be the ones to raise that child. The surrogate, of course, if a termination were to occur, it's usually later on in the pregnancy. It is a difficult medical procedure to go through and can be traumatizing for her as well. So we all need to be prepared going into the match, that everybody's on the same page in terms of that.
Yeah. Another point I think to really discuss is the level of communication that's expected on both sides. I remember sitting down with our first surrogate, and she said, look, I'm really excited to help you guys, but I also want you to realize that I have a life and kids. And so if you're expecting me to have a call every day on how my day went, I won't be able to provide that. She said she was really happy with daily touch points by WhatsApp, and that if we wanted a longer conversation throughout the week, we could schedule something like that. But she made her expectations very clear from the beginning, and it was exactly aligned to what ours were, which was great. But I have seen some couples where that is not discussed initially, and it can become an issue down the line because the surrogate might be expecting something from you as an intended parent, and you either don't have the time or vice versa. And that can cause for, some tense relationships.
Yeah.
So having those conversations up front, I think, are very important.
Yeah. A good way to think about it coming into this talk is, rate the communication level that you want to have from a 1 to 10. Do you not want to know anything? That would be a 1. Or do you want to be talking to her every day? That would be a 10. And, let that kind of guide that conversation so that all the expectations are managed going into the match and everybody's on the same page.
Yeah, absolutely.
So once you're matched, we can talk a little bit about the screening process. Once you're matched, your fertility clinic is going to arrange for the medical screening of your surrogate. At this point in time, most likely you've already created embryos, and so your part of the screening is probably completed. You may need to update some blood work for the infectious diseases, but that should be all that's required as long as you've already created your embryos, you've had counseling, all of that already. The surrogate is going to have a consultation with your IVF clinic. She will also have her counseling session, most likely with her partner. And her partner will also require blood work for the infectious diseases. They'll do blood work to make sure that she's healthy, test her hormones. They'll do a physical, which may include a pap smear. And then she will have an ultrasound as well. Most often the ultrasound that we see for surrogates is called the sonohysterogram, which is where they'll actually inject fluid into the uterus to see the shape of the uterus and make sure that there are no growths such as fibroids or polyps or endometriosis, to make sure that everything looks healthy. So that's something that your surrogate can expect. It's not the most comfortable procedure. Usually they recommend to take some sort of Tylenol or Advil beforehand. So just so you know what she's going to be going through. So it's quite a vigorous day of screening that she will have, hopefully all in one day. And then a few weeks later, hopefully you will have medical clearance for your surrogate to proceed into the next step.
And say a surrogate is not in the same location as you. This doesn't necessarily have to happen at the same clinic. Is that correct?
So not necessarily, no. Most clinics are requesting for the surrogate to come to their clinic for the screening. However, if it's not possible, satellite screening can be arranged if needed. And so the agencies are helpful with that, typically to help arrange those appointments with another fertility clinic. Otherwise, she would need to, if in an independent journey, she would need to seek out a fertility clinic to help her with that. Mm-hmm. But definitely can be done remotely if required.
Yeah, I believe for the screening part, we had done ours in Vancouver. And then the first time we actually met all together in person was for the transfer.
Wow.
Down the line.
Oh, yeah. Cross-province surrogacy, that's what you're going to get.
Yeah.
And, you know, even if she does travel to your clinic, if it's nearby, for her screening appointment, that doesn't necessarily mean she'll have time to sit down and have, you know, a meal with you. We like to help organize that if possible, speaking personally. But she might have a really tight day. And, you know, for the screening process, she may not want to be away from home for too long. So it could be a really tight trip, tight itinerary.
And that's also a conversation to have with her, whether she would like you to be at those appointments or if she's more comfortable, you know, just going in on her own and doing what has to be done and then heading back. Those are, you know, part of those conversations to have ahead of time.
Yeah, absolutely. So once screening is done, then you will most likely at this point move into the legal agreements. Legal can really be started at any point of time in the match, but most agencies will want to engage the lawyers after the medical screening has been done. And this is just to ensure that you're not retaining and paying for a lawyer until you know that she's medically ready to proceed with the surrogacy journey. So typically it's going to be done after medical clearance is given by the clinic. And there will be 2 lawyers involved here. So the intended parents will have a lawyer. Their lawyer will write the agreement and then present it to the surrogate's lawyer. The surrogate's lawyer will then review that with their client, the surrogate, make sure that she understands and make any negotiations as they feel is needed. So this process can take a few weeks to complete, depending on how fast the lawyers are able to meet with you and review the contract with you and how many negotiations and changes are needed to be made. The agreement is quite long, so it's a lot to learn and a lot to go through. They're typically about 45 pages long. And what you can expect on these agreements is, you know, who are the parents of the baby, just ensuring that it's very clear that the intended parents are going to have sole custody of that baby. It'll also go through the reimbursements and what has been agreed upon for the maximum reimbursement to that surrogate. It'll go through lost wages, as well as, all of the scenarios that you could think of if something were to go wrong and what happens in that instance. So they're very detailed, and your lawyer will probably have already a kind of template or outline to draft that agreement already in place so that they can then just adjust it for your specific needs.
And we're going to do a whole episode on this in a couple of weeks to dive into the legal aspect a lot more. This is just a very brief overview of where it sits in the process.
Absolutely.
So once the legals are done, we move forward to, the medical side. Do you want to touch base a little bit on the timelines and what a surrogate can expect in terms of medication and what that process looks like?
So this is the fun part, getting pregnant. Not as fun as our typical getting pregnant, but so typically this is going to be the process of having an embryo transfer. Most journeys now see frozen embryo transfers. However, in the past, we did see more fresh embryo transfers. Today, most likely you will have a frozen embryo transfer. It's much easier for scheduling. We don't have to line up the surrogate's menstrual cycle with the egg provider's menstrual cycle. So it's much easier to do a frozen embryo transfer. And with the technology of freezing these days, there's really not going to be a difference in the success rates. So you can probably expect to have a frozen embryo transfer. Typically what's going to happen is at the beginning of the surrogate's period, so at the start of bleeding, she will go to the fertility clinic, usually on her second or third day, to go to cycle monitoring. Cycle monitoring is blood work and ultrasounds. So the blood work is to assess the hormones, and then the ultrasound to look at her uterus and ovaries to see if she's ready to start those medications and prepare for transfer. Typically at this point, she'll start with an estrogen protocol to help get the lining of the uterus ready to accept that embryo. She will then take that usually for 10 to 12 days before returning to the clinic for what's called a lining check. She'll do the cycle monitoring again, but the focus will be on the lining of the uterus to make sure that it has reached the appropriate thickness again for embryo transfer. At this point in time, if her lining is good, then they will schedule the procedure for the embryo transfer, usually within 5 to 7 days of that appointment. If her lining isn't quite ready yet, then you might expect another appointment, another lining check a few days later or a week later to be reassessed to see if we can then book the embryo transfer. Once it's booked, another medication called progesterone is going to be added to the protocol. And then she might have other medications as well added on to help with implantation, such as a type of steroid or perhaps even an antibiotic to make sure she's clear of infections before the procedure. Every doctor is going to have different variations of this protocol, but the main two medications here are going to be the estrogen and the progesterone. The estrogen usually is in a pill or a patch, an oral pill or a patch on the skin. And then the progesterone can be either an injection or a vaginal suppository. So that's the one that surrogates, kind of have to push through, and they usually have to take both of those medications for the first trimester of pregnancy, so about 12 weeks. So it's a big one that we prepare them for. The embryo transfer itself is a really quick procedure, not too uncomfortable for the surrogate. Usually the most discomfort comes from the fact that she has to have a full bladder for the procedure. But otherwise, it's really simple. It's a catheter that's going to be inserted through the cervix into the uterus to drop that embryo off. And then that's it. It usually takes about 15 minutes total. She might be asked to rest a little bit after the procedure, and then she can go home. And then 2 weeks after that, we have our first our first pregnancy test. So this is going to be the beta HCG pregnancy test, which is a blood test to check her HCG levels. And that will tell us if she's pregnant or not. She might do home tests as well, which is always fun to see, the home pregnancy tests. And it's important at this time, I think, to communicate with each other in terms of how you want to find out if there's a positive pregnancy test. Kevin, do you remember finding out for the first time, like when your surrogate was pregnant?
So one thing I was going to say is when you go into this, remember that the science gets us so far, and then at the end of the day, nature, takes over. And I think a lot of people go into it thinking that they're going to have control over it. It's going to work the first time. I know we did. And so that first transfer, it can work. But I would go into it with the expectation that it may take a few transfers. In our case, I remember getting the first, tests back, and it was negative, and we felt pretty gutted for a few days. But you just had to pick yourself back up and you try again. And luckily, the second time was the right one for us. One thing I think I wanted to mention on the tests that you're looking, the number that you're looking for, is it the HCG or HGC? I forget.
HCG.
HCG. You're looking for that number to double every 24 or 48 hours.
It's going to double every 48 hours. That's what they're looking for. Yeah.
Yeah. So I remember that process. And then, so you get the first baseline, and that will give you an indication of, whether it's looking positive or, questionable. And it's that second test 2 days later that really drives whether or not there's a confirmed pregnancy.
Right. Yeah. And that wait can be really stressful. But as long as that number is going up, doubling within 48 hours or somewhere in that ballpark, you should be good to go. Some doctors will repeat it a number of times just to make sure that it keeps going up as they'd like it to be. And then others might just only have the first 2 tests. So it's really exciting part.
And it's at the stage where you could possibly identify that you may be pregnant with twins. Is that correct? If the number is significantly higher?
Yeah. So I'm not sure how science-based this is, but so typically when you have your first pregnancy test, your number might be in the hundreds. So 100, 200, 300, somewhere around there, depending on what day the pregnancy test is done. Sometimes we see the first pregnancy tests in the thousands, and this is where we might suspect that it could be a twin pregnancy, but it's not 100% true that every time you see a high number like that, it's going to be twins, but certainly it does increase that level of suspicion. But we won't know until you have your first ultrasound, which is going to be about 2 weeks after the first pregnancy test.
Great. Is there anything that surrogates can also do after the transfer that help? I know some options might be acupuncture, for example.
Yeah, acupuncture is a great tool to add to your protocol or to your surrogacy journey. Often acupuncture it can be done leading up to the embryo transfer. And we do see a lot of surrogates doing acupuncture on the day of embryo transfer too. And in that case, it's done actually before and after the embryo transfer on the same day. And this can help increase blood flow to the uterus. And then, of course, you can continue it afterwards as well. But we don't see that quite as often after the embryo transfer itself. But I think acupuncture is really, really great. I totally believe in that stuff. But we should have a naturopath and an acupuncturist on here, Kevin, to talk to us about that for sure.
All right, so let's say we got a confirmed pregnancy. We're now, moving ahead. Let's talk a little bit about the providers and the medical care and how things transition from being at the fertility clinic to more of a traditional doctor-patient setting.
Right. So typically the IVF clinic will graduate the surrogate somewhere in the timeline of after that first ultrasound up to 12 weeks. So most IVF clinics can only monitor a pregnancy until 12 weeks. So usually in that period of about 6 weeks, she will be then referred to her obstetrician or her midwife to continue the prenatal care. Certain milestones here. So at 12 weeks, a lot's going to happen. She's going to stop her medications. You may also have an NT ultrasound or non-invasive prenatal testing. And this will help to determine that the pregnancy is going well and there's no issues such as spina bifida or Down syndrome or anything like that. And then, at this point, she's going to be referred to her OB and midwife to continue care. That process from there, it's going to be a very typical pregnancy for most. So the surrogate will be able to choose her obstetrician or midwife, typically somebody who's close to her home and, who's going to be able to deliver her at the hospital close to where she lives. So just to remember, the surrogate's not going to be traveling to where you live, the intended parents, to deliver the baby.
You say that as if that was an expectation you've come across.
I get that question a lot. Is where is she going to deliver? And I have a lot of surrogates asking that too. And I think surrogates, when they find out that they're going to be delivering where they're comfortable, is really helpful. So she will continue going to her provider of choice. And from there, it's going to be managed exactly like any normal solo personal pregnancy. The big difference here is that there's going to be another party involved, the intended parents. So what's important at this point in time is to make sure that the provider knows that this is a surrogacy journey, that there are intended parents, and most will ask for the surrogate to sign a medical release form so that the provider can discuss any type of complications or concerns, or even just to tell you how the pregnancy is going. So it's really important to be able to have that relationship with the provider as well, although it's not always available to you, as you know, Kevin, from personal experience.
Yeah, I'm trying to think. I actually don't think we interacted with the doctor at all. And that might be because the doctor didn't want to, in that doctor's perspective at the time, our surrogate was the doctor's patient. And I don't believe we even signed a release form or anything. Everything had to go through our surrogate. But again, this is 10 years later. Surrogacy is more common now. Doctors may be more open to different practices. But yeah, I don't believe we had any contact until the actual delivery.
Right.
I know we just got a question about, will the surrogate take the usual pregnancy vitamins?
Yeah, absolutely. It'll actually be recommended that she starts her maternal vitamins or pregnancy prenatals before the embryo transfer. So this will probably be requested by the IVF clinic. And a lot of surrogates, when they start the process of matching, will already take it upon themselves to start their prenatal vitamins at that point in time. So yes, she will be taking prenatals all the way through her pregnancy, and that is something that is expected.
Great. Thanks for the question. Okay, so let's move on to getting ready for delivery. There's obviously two scenarios here. It could either be a natural birth or a C-section. Regardless of the delivery method, I think what is important as the IPs is to reach out to the hospital and make sure that the staff is aware of the situation. You don't want any surprises at the last minute. I remember in our case, our lawyer drafted up a letter that was sent out to the hospital, informing them of who the parties were, whose wishes, or what every party's wishes were, especially once the baby arrives, who is responsible for making medical care decisions. And then I think it's also just planning as if you were having a traditional birth, right? So make sure you have all the things ready in a bag in case you're called at the last minute to come in for a delivery. But definitely being in touch with the hospital and getting them to give you a tour if that's possible is a huge help. And I know both the hospitals in Langley and in Sarnia were extremely accommodating in helping us with that.
Now, Kevin, when you were expecting your surrogate delivery in BC, when did you plan to be there?
So our delivery date was supposed to be December 26th, and we just wanted to be there for the birth. So we flew out 3 weeks early, just in case, expecting her to come earlier, but she took her time, and Christina started having contractions on December 23rd. I remember we were,
It's good that you were there.
Yeah, it was right before Christmas,
Yeah.
and four of us, because our surrogate had her friend with her for support, were walking around the mall while everybody else was doing Christmas shopping in the hopes that the baby would arrive that day. And we went back to the hospital late at night. They told us, no, today's not the day. And then she arrived on December 24th.
Amazing.
But it was great to experience kind of a natural birth and that excitement around, is it coming now? Is it not? Versus with our son, it was a planned C-section. So we knew exactly that June 22nd at 8 a.m. He'd be born. So it was a very different experience, because the first one, you just have your bag and walking around, waiting for the moment to happen. And the other experience was, just going up, picking up your package at the expected time and date. But it was magical in its own way. So I feel very fortunate to have experienced both.
Yeah, I think it's a good idea to plan to be, if you're far and need a flight to get to your surrogate, it's good to plan to be close to her, I would say at least 2 weeks, if not pushing it would be 1 week before the expected due date. The nice thing is that a lot of providers will be checking her weekly at that point, and can maybe have some idea of when the delivery might be coming if it's not something that's planned. So it's nice to, communicate with your surrogate or your provider about that. But definitely get your hospital bag packed and be ready because we've had some surrogate births in half an hour or less, so you want to be close if you want to be there for the birth itself.
Yeah, and also part of the conversations to have with the medical staff is understanding what's going to happen the day of. Do they allow both IPs in the room? Some hospitals may only allow one extra support system. So it could be the surrogate's husband. Maybe it's the surrogate's husband plus one of the IPs. Every hospital has different policies. So making sure you're aware of that and understanding if there are limitations, who will be in the room. If everybody is allowed in the room, who's going to do skin to skin? Who's going to cut the umbilical cord? The hospitals are pretty good at walking you through all those different aspects and having a birth plan, just like any regular birth.
Yeah, absolutely. And your counselor may also be somebody who can help you with this before the due date, as well as an agency is in terms of like asking those questions and making sure that everybody's on the same page at the time of the birth. And just remember, not every birth, or probably no birth, goes as planned. So while you may have a specific birth plan in place, your provider will probably tell you, it might not happen exactly the way you picture it. So just keep that in mind as well.
Yeah, and that's absolutely normal, I would say.
And then I guess the last thing we wanted to discuss is your relationship and communication after the baby is born. Kevin, can you tell us a little bit about your experiences?
Yeah, so we're still very much in contact. Neither of our surrogates live close by, so we don't get together very often, but we're in touch on social media. Usually around the time of year when our kids were born, we typically send them something, whether it's flowers or whatnot, just to let them know that we still think of them, and the gift that they've given us has been incredible, and it's the gift that keeps on giving. So I would never want them to ever think that we don't think of them, which is why that's a small gesture we do every year, but to me it's an important one. And yeah, we've maintained really good relationships, and it's interesting because we're getting now to a stage where our 8-year-old is starting to ask more questions, and I think at the right time, she will probably ask to meet her surrogate. And we're very fortunate to have a relationship with both of them where I think they'd be open to that. And again, I think that relationship, make sure you define what your expectations are from that initial consultation, because it can be a lifelong relationship that you develop. And if that's something you're not interested in, that is completely okay. But make sure you have that conversation with your surrogate so that if she is looking for maintaining some kind of contact in years to come, you guys are all on the same page.
Absolutely. Amazing.
Right.
Well, there's so much more we can talk about, but I think that wraps it up for today. So if you have any questions about surrogacy or anything that we didn't get a chance to touch on yet, please send either Kevin or I your questions, and we'll probably have a part 2 about this, or we might be able to address it at one of our upcoming talks. Next week, we're super excited to have Dr. Romaine from Tripod Fertility, and she's going to really talk more about the IVF process in detail from a doctor's perspective. And then the following week, we're going to be speaking with Michelle Flowerday to go over the legal process in Canada. Great.
Well, I look forward to next week's chat, and thanks for joining, everyone.
Thank you so much for joining us. Have a great day.
Bye, Petra.
Bye. Thanks so much for joining us. Please like and subscribe to our channel, and we hope to see you next week.